LDS Hospital.
Welcome back to Good Things Utah, everybody. Dr. Tanya Bowles joining us now. She is from the LDS Hospital Oncology Department there. She is a surgeon and she sees a lot of skin cancers. It is May and it is Melanoma Awareness Month. It was rainy yesterday, but the sun's out today. It's out all week. This is time to start talking about this.
It'll get you.
And thinking about it. Welcome to the show.
Thank you. Thanks for having me.
There are different types of skin cancers. I think all of us have heard of melanoma, but what are the other types?
The most common types are basal cell cancer and squamous cell cancer, and they're the most common cancers in the country. They aren't even on the list of cancers because they're so common.
What's the difference between the two?
The difference is basal and squamous cell cancers don't come from what we call pigmented or brown cells. They come from different cells in the skin. So they look different. On the skin, they're red or scaly spots on the skin. They don't arise from a mole.
Yeah, I had one of those. I didn't have the cancer, but I had what was called pre-cancer right here underneath my eyes. And I went to the dermatologist, and she said she could tell because of the scaly nature of the skin.
Correct.
Are those from the sun?
They are. They're directly sun-related. And so some of the preventative things we're going to talk about in using sunscreen reduces the risk of deadly melanomas, but it also reduces the risk of those more common, less deadly cancers.
So you say less deadly, but how serious are those?
They can be very serious. If they grow, they can cause problems where they grow. So on a person's face, they can result in big wounds on a person's face when they have to be removed. They rarely spread to other sites like melanoma can in the body, but they can be a big deal for people that have to have them treated and removed.
Are there places on the body that are more susceptible to have these type of cancers than others?
Yes, the areas that are most sun exposed. So on men, it's the head and neck region, which includes the top of the scalp, the ears, the nose, the neck. In women, legs are more common than in men because women tend to tan their legs more deliberately. But still, in women, the head and neck area is the second most common site.
Melanoma also sun-related, but does it have a genetic component as well?
It can, although the vast majority of melanomas are not genetically related in that the parents don't pass a gene to their kids. However, skin type matters, and in Utah we have among the highest incidence of skin cancer in the country, and it's because of fair-skinned people with light-colored eyes and fair-colored hair.
I wonder who she could be talking about, Anisha.
You and I sitting right here. So what can you do? What preventative measures should everyone be taking?
So sunscreen is our first defense against the rays from the sun. So sunscreen is important and you have to wear it. Putting it on every couple hours is important. But in addition to that, we can reduce our exposure by staying out of the sun when it's the hottest, and that's between 10 and 2 in the day, and covering up, wearing a hat, wearing longer sleeves and pants reduces your exposure.
I wouldn't necessarily wear this outside, but I can get on board with the sunscreen.
That's right.
And what is the level of sunscreen you should be putting on?
SPF 30 or higher. SPF 100 doesn't block 3 times or more of the sun's rays than SPF 30 does, so you shouldn't pay 3 times as much for a higher SPF.
Good to know.
Yeah, so when you have like a redheaded
I debate it.
right?
I know, with my redhead, I debate, do I do a 500 block? Spray or lotion better or worse?
Lotion is better than spray. I think the dermatologist and I agree on that spray, we don't get as good a coverage as we think we're getting, and you shouldn't use spray on little kids. We don't know yet the evidence about inhaling what they're getting from the spray, if that's safe or not. So in general, I would stay away from sprays and use the cream.
So if people want to get more information, where do they find you guys online?
Yes, we'll have our link posted, and also the American Association of Dermatology has good evidence, and also the Skin Cancer Foundation.
So all the information about LDS Hospital, including their website, right there on your screen, everybody. We will link you from ours. They're so great about answering your questions, and please also sunscreen and get checked every single year. Dr. Bowles, thank you so much.
Thank you. Thanks for having me.
Okay, coming up next, there's something that you use at home, maybe every day, that could improve the look of your skin. We'll tell you what it is in our Makeup Minute.